Good afternoon, and welcome to our 2020 State of the College Address for the UCF College of Nursing. I'm Christina Gonzalez, Assistant Director of Alumni Engagement and Annual Giving, and it is my honor to work with and welcome back our network of more than 12,000 night nurse alumni who are leading the charge in the profession at all levels of practice in Central Florida, across the US, and around the world. We also have members of our Dean's Advisory Board, Alumni Chapter, and donors from across the country tuning in, along with our local healthcare community. This year, which is the International Year of the Nurse and Midwife, has been a monumental one for the profession and the college. Before we begin what will certainly be an enlightening discussion, I would like to go over a few housekeeping items. This event will run for 1 hour, and we will not be taking a break during our time. We welcome your questions during the event. Dean Soul will be answering questions at the end of the program, so please use the Q&A feature. You may also like questions that others have asked in the Q&A to bump them up in the queue. Use the chat feature to say hello and engage with us during the program as well. This afternoon's virtual address will begin with a question and answer session with Dean Mary Lou Soul and Andrea Eliscu. Andrea is one of the newest members of the Dean's Advisory Board at the college, but is not new to the profession. She is a registered nurse and medical marketing specialist with decades of experience. As founder and president of Medical Marketing Incorporated, she provides leadership and guidance to help clients plan and prepare for the rapidly changing healthcare industry. She is the recipient of numerous professional awards and is a sought-after speaker and presenter and the author of 4 books. Andrea is also an active member of the community and serves on numerous boards. Welcome, Andrea.
Well, thank you, Christina, and I'm very excited to do this today and have this conversation with Dean Soul as we learn about the state of the college in this new norm that we're all living in. You know, our world and UCF has been dealing with a global pandemic since March. And healthcare, as we've known it for years, and as I've personally worked in it for years, has changed. And so we as a society, as caregivers, as patients, we have learned over this 6 months more than ever that we're going to become much more digital literate as we adapt and use telemedicine as our new norm. And therefore, nursing education is changing, and we're moving into more virtual and simulated and innovative learning experience that we have to plan for our students and our students have to live. So when we were thinking about what to ask the dean to make sure we all understood what was going on, it really came up with what is the College of Nursing doing to adapt to this new normal? How are we preparing our nurses at all levels to practice in these ever-changing times, and what's that future going to look like? And those are some of the questions that I'm going to be asking Dean Soul. So Dean Soul, before we go into this current state of the college, I think it's important to reflect back on what happened this last year so that we can see how we are going forward and will go forward. And one of the things that I found particularly interesting as someone who's been around UCF since it was FTU, when it was all about engineering, is that now our simulation center attained accreditation this summer for us. But I'd like you to tell all of our listeners, what is the significance of that achievement?
Thanks a lot, Andrea. What a whirlwind this truly has been. And it's been a goal of ours to have our simulation center accredited. And I will tell you, having it accredited this past year was monumental for us as we transitioned to virtual learning. So we received our accreditation from the Society for Simulation in Healthcare, which we call SSIH. And it was for our excellence in teaching and education. And the reason we believe this simulation accreditation is important is that it validates the expertise of our faculty and the staff in this growing field of simulation. We chose to be leaders in this area. And in fact, 1 in 10 of our faculty are certified healthcare simulation educators. Other nursing schools would die to have that number of educators on their faculty. And 3 of these experts are advanced simulation certified and are among the world's leading experts in their field. The Simulation Center also has a certified healthcare simulation operations specialist who was one of the first worldwide to also earn this designation. So we've leveraged our expertise and our leadership to become a leader in healthcare simulation, education, and research. And we're only one of a few to offer a graduate degree and certificate in the field that's going to be more important than ever in this pandemic world and post-pandemic world.
Well, congratulations, because that is just sensational. And it's exciting for me as someone who is in healthcare and lives in Central Florida and has seen UCF grow from what it was, that this College of Nursing is focusing on this emerging field. So that's really special. But can you share with our audience, what are some of the other key achievements that happened in this last academic year, even as COVID came in and changed everything?
Well, Andrea, you know, we started last academic year hoping to have and conclude our 40th anniversary celebration of educating nurses, which is a major milestone for Central Florida. And we're looking forward to having a rescheduled gala in 2021 to celebrate 40 years of graduating night nurses and to honor those 40 noble night nurses who were selected to receive awards. So during the past year, we continued to improve our national rankings in US News and World Report. Our best online master's in nursing program was cited for being number 31, which was 20 points higher than the previous year. And we're proud of our extremely wonderful online nursing education. UCF alone is ranked number 16 for best online bachelor's programs. And we have, it recognizes our online RN to BSN program and the Florida College concurrent AS to BSN programs that we offer, which is one of our largest programs. And UCF is once again ranked number 16, tying with Cornell for the most innovative schools. And we believe that the College of Nursing is equally part of that Innovative School Award. Our graduates have had continued success on licensure and certification exams. In fact, 100% of our graduates on our primary, family, and adult nurse practitioner programs and our acute care adult gerontology nurse practitioner graduates have achieved pass rates on their certification exam. Other schools that are much highly rated than ours do not have that level of a pass rate on these exams, and we're extremely proud of that. And our BSN graduates have consistently had great pass rates on their NCLEX exam. And in fact, even in this COVID area, 98% of our graduates passed the NCLEX for the first half of the year that we have data for. And that's above the average of 89% in Florida and 92% in the US. So we're anticipating we're gonna have continued success in this area. Our class of 2020 had outstanding achievements. The spring 2020 graduates were the most academically talented ones we've ever had. 8 students of that class, 8, and I have never seen 8, earned a perfect 4.0 GPA when normally we have 1 or 2. And in the summer, we graduated 26 students with their Doctor of Nursing practice degree. This was both in advanced practice and in nurse exec skills, and that's the most in our single semester. So it's addressing that national call for more doctorally prepared nurses. And our biggest achievement that we'll talk, this is probably the more fun things to hear about, was halfway through the last academic year, our success amidst a chaotic COVID-19 environment. And I attribute all of the success that we have to our innovation, our flexibility, and our adaptability, and the wonderful faculty and staff that we have to support our students.
Well, this is really exciting because before there was even a College of Nursing, there was a College of Health. And I was on that advisory board. And at that time, nurses that were at UCF practiced hand washing virtually because there were no sinks. So when you tell me the things that have been achieved over the last decade, it is truly mind-boggling. So let's go to COVID-19 because it's changed healthcare and higher education. Our world really turned upside down in March, which is 6 months ago, and it was happening so fast. So we got a question in from one of the alumni chapter boards, and what they want to know is how did the college deal with these changes so that you could provide continuity in the learning of the students across different degree programs and our campuses? And then how do you communicate these changes to students and parents and faculty and clinical partners? Because that's huge. Tell us about it.
Yeah, absolutely, Andrea. You know, in March, we started monitoring the situation, and the week of spring break, we realized that life as we knew it was changing, and we had to change right with it. And again, thanks to all of our unbelievable faculty and staff who were able to be flexible, and we talk about they were able to turn on a dime and continue educating our students so that they could meet their learning objectives. We were able to maintain all of the excellence that we normally have, but we had to do it in a virtual environment. And we had to do it because we knew nurses are needed most now than ever before. So we really began by continuous and ongoing communication with everyone. And we continue to do this to this day. So we started with regular Zoom calls. You know, nobody knew the word Zoom 6 months ago, and now it's a new verb. So, you know, we were able to meet with our faculty. At that time, we were meeting weekly with them to let them know what was going on and how we could answer their questions and help meet their expectations and help them teach the students. We met regularly with students. We met with every single cohort together with the faculty so they understood where we were, what decisions we were being made, and why we were making those decisions. And, you know, really what was most critical was when we had to pull them from clinical experiences, both at the undergraduate level, the graduate level, and that was really tough. So we were able to do our online education because we have been a leader in online education since the 90s. So that was easy for us to transition to online delivery of classes. It was easy for us to adapt to the Zoom. But we had to look at how did we do that clinical experience. So with that, we were able to have virtual simulation. Those simulation experts that helped us to achieve the accreditation were able to offer a whole new format of simulated experiences that could be offered virtually with the students. And they were able to participate as though they were there in person. We were able to leverage new expertise we've been developing in telehealth. We decided a couple years ago to try to begin investing in that area. And that was absolutely critical, in particular for our graduate students who had to have that face-to-face clinical, and they were able to get that through the telehealth. And one of our faculty is actually a certified telehealth educator in addition to our other simulation individuals. So she provided leadership in this area. So some examples we used recordings of prior simulated activities and shared if it was a live situation. And the students really were active observers. They were there to make decisions. We were able to teach health assessment via webcam while students were able to listen to a patient's lungs, feel the abdomen for a mass or for pain, and to check pulses on a volunteer family member who agreed to do it per our rules. And I think one of the more exciting experiences we had was we had a study abroad that was scheduled to go to Peru. And we had a group of around 12 students that were ready to go. And they continued that experience with a virtual Peru learning experience. So using Zoom, a trained embedded patient actor who's also a certified medical translator, and lots of creativity, the students were able to simulate the same experiences they would have if they were in a surgery clinic in Peru in rural area. And our faculty had already been there, were able to do that. So we had good leadership in that area, and it was an extremely creative way so that they could meet that learning objectives for an international experience. We're also able to prepare our students for new jobs. We knew that we had that whole May graduating class that needed to get jobs. And typically they prepare for interviews in a face-to-face environment. So we created a Zoom interview experience with mock interviews, and our alumni, many of who are on today, participated in these mock interviews because we knew the graduates were going to have those same type of virtual interviews when they were interviewing for those jobs as institutions were closed down. So that was another really great experience. And I was able to watch tapes of many of these things and really just ascertain how wonderful it really was. We were able to help in the community needs as well. We've been working closely with a senior living community, and we understood that those adults in those senior retirement communities really were suffering from social isolation. So a group of individuals who volunteered developed connections with those seniors, to have calls weekly with them. And the feedback we got was really, really impressive. They were glad to have that connection, and it was good to have that senior youth connection in that. So I'm really proud of the faculty and the staff and our students. They were resilient every step of the way. We reminded them that they had developed their critical thinking skills and they weren't going to lose them, but they had to stay connected, and they really immersed themselves and learned really well during those challenging times.
This is so exciting that I want to thank you again for allowing me this privilege to hear you tell our story, because this is a really big story. I think anybody that was watching the news from March, April, May, June, you heard over and over about the nurses and these, frontline nurses. And we maybe thought of them as nurses like used to be trained, but what you're telling me is you have to learn used to be trained, and now you have to learn future training, and that you all did it without missing a step. But I want to ask you about the graduate students, because I think probably they were in the middle of conducting doctoral projects and dissertations. So how did the pandemic alter their experiences?
You're right. Our goal was to have everybody graduate on time and meet all their objectives. So we had several students in their projects and completing their dissertations, and had to, again, switch on a dime of how they did those experiences. So our faculty worked with the students and worked with those clinical agencies to adapt those projects from face-to-face to virtual. So for example, recent PhD graduate Valerie McKenna, who also earned a certificate in healthcare simulation, was interviewing students face-to-face for her dissertation. And she'd really only gotten halfway done and was scheduled to graduate. She was able to conduct the other interviews virtually, got very rich data from both her face-to-face and her virtual formats, with really no difference in the outcomes that she had. So she now graduated with her PhD this summer, and she took a position as a healthcare simulation education director at the University of Connecticut School of Nursing. So we are proud of that. Our DNP graduates had to again alter their projects as well. So they were doing practice changes in acute care and primary care settings, and they had to virtually do theirs differently as well. But everybody that was scheduled to graduate in the summer graduated at undergrad and the graduate level, and we're extremely proud of that.
It's really just hard to imagine, but what keeps playing in my mind is you took students and maybe they didn't know that this wasn't the normal, because during their education, it was their normal. But talk to all of us a little bit about the clinical experiences, both in the lab and in the community, because with COVID, it was very dangerous and very limiting, and physical distancing and PPE equipment and all of that. Some students maybe didn't have this direct patient experience or in-person labs. So how are they prepared?
We had to work really hard with all of our faculty to ensure that our undergraduates and graduates could get back to direct care experiences as soon as possible, whether it be in the lab or whether it was in the clinical setting. So as soon as we could do it safely, we really wanted to return students to the lab and to those experiences. And until then, we really used all the simulation and technology that we could to ensure continuity. But everybody really needed that direct care experience. And our graduate students in particular have to have a minimum number of hours to graduate. So we had to continue to ensure that they got experiences. So one of the things we did in the summer was we offered a delayed boot camp for our acute care nurse practitioner students. They had to be ready for their fall course and already had a delay in the spring semester. So our faculty brought them in small groups into a boot camp in the lab so they could practice their skills to care for those acute care patients that they're going to need to care for in the hospital. So that was like our first foray into the lab. And the second thing we did this summer is we had a brand new group of students. Can you imagine bringing a cohort of students in, never been in nursing before, had another degree, and they had to start their whole semester virtually. So for them, we started them virtually, but gave them at-home skills training. They picked up their skills kits at a drive-through event to practice with Zoom with the instructor, and they had some volunteers that helped them in their home setting. Following that, we returned them to campus the end of the summer for a one-day skills lab boot camp. And let me tell you, I was nervous. I was like, we got to get them back here, but how do we do it and how do we do it safely? So we all worked as a team. to ensure that we could bring them in. It was the second lab, in addition to that graduate lab, that we had since the pandemic. And we had students in small groups. We followed all of our protocols for COVID and disinfecting and personal protective equipment. And we created that hands-on learning where they could showcase and fine-tune their skills. I volunteered as a faculty that day, so I could see firsthand what they did. And I will tell you, those students, and these were second-degree students, but they were so prepared. They kept saying, we are so glad to be here. We're ready to be on campus. And they were ready, and they were adept with their skills. They had obviously practiced their things, and they had come in and they were able to practice putting in G-tubes in, practice with their IVs. They were able to practice, and they were just incredible. So it was a lot of fun to help them, and I felt much better that I was there face-to-face with them that first day to see that everything went as we had planned.
And I bet they were terrified that the dean was acting like she was just another nurse and, you know, just a faculty member.
I will tell you, that group didn't quite get it as much as the second group that I volunteered with, that when I was, another time that I volunteered and gave them a little more questioning about what they were doing. But the first group didn't really know, even though I told them what I was. So we had fun with that. And then our graduate students, we have had them back since summer as well. We felt like we had to get them back. In particular, we had a large group of primary care students graduating in the summer, and we wanted to get them back. Most had completed their minimum number of hours, but we had several that did have to complete additional hours, and we were able to work with our clinical partners to have telehealth experiences for them. So they were one of the early adopters of telehealth with that faculty leadership that we have.
Well, that was going to be my next question. I know you're very engaged in the community and with our hospitals, but how during that time when everybody was so careful about this disease, the numbers were growing, how did you work with the hospitals to resume the clinical experiences for our students so quickly? Because you've said it a couple of times, you can't have nursing education only online. So how did you pull that one off?
Well, Andrea, it really was a team effort to get us back together at the clinical settings. And it was both hospitals and it was our primary care sites because of our advanced practice students. So we had our students in primary care, acute care, and what was most important to me was our communication. We already have had those strong relationships and we're able to pick up the phone, and oftentimes it was even a text, to work with our local CNOs across the region to see where we could get clinical experiences such as telehealth. And it was such as, can we just pilot this? We have 5 students that need to graduate with their primary care degree. Can we get them in for telehealth? You have a staff member who's willing to do it. And they said yes. They were able to provide projections for us. To me, another key thing, they were able to say, here's our situation, here's where our units look like, so we could think where our students were going back into. They were able to communicate the availability of PPE and what was expected for our students. So our team, our faculty communicated with them, I communicated with them, and our clinical placement coordinators communicated with them regularly to look at alternative clinical sites that were impacted less by COVID patients. All of our students in Practicum for the summer, and this was another group of second degree accelerated students, were able to get their Practicum experiences. Some of it was reduced a little bit and they had to do some virtual experiences, but they all got the minimum we required them to graduate. All said their critical thinking skills came back. But it was those relationships that helped us get these experiences. For example, one of the CNOs in the region, it was one that was less impacted. And we said, okay, we can't be, let's say, in downtown Orlando, but can we go in a regional site? So we were able to get additional student placements over in Melbourne, up in the Volusia County area as well. So that was another, having those relationships to say, we've got to get these students graduated. Our goal is to get them to graduate. So how do we do it? And they were most helpful for us to do that. We all kind of, I think, tentatively went back, but it has gone really well.
Well, and you've survived and thrived the spring semester and the summer semester, but now we're in this new normal. Is it fair to ask you the lessons that you learned and the adjustments that are now being made? Because what we knew, that's history. What we know and where we're going, that's our new reality. Tell us about that.
Well, that's true, Andrea. We had to learn, and I will tell you, every day is still a new learning curve. I literally said to the faculty yesterday, my knowledge today of what policy is at 4:27 p.m. on this such and such a day may be different tomorrow. So if nothing else, the one thing we've learned is that we have to be flexible and stay current about what's going on in the world. So that's the first thing. One of the other things we did was I've been very active with the other deans and directors across the state of baccalaureate programs and higher degree. So we met weekly early on to say what's going on, how do we move us forward? And I'll tell you, UCF, we were way ahead with what our plans were and getting students back to the clinical setting and getting new students to start their programs. I was really, really pleased with that. Another thing we learned is you have to have policies and we have to be willing to write them. We had to write new policies and we had to coordinate with our legal team. We had to provide some additional consents, participation waivers, other things to protect privacy if students were practicing something at home. So we continue to develop new policies. Even yesterday, how do we get policies of what's expected of students to come back in the clinical setting? What's expected of our faculty? So these were things the university's writing emergency policies, and we've had to do the same thing. We know that we have to establish clear-cut learning objectives. What do the student must do? What must be accomplished? And what do we need to do to get there? We've had to establish policies and procedures. We continue to look at hands-on learning and simulation using evidence-based safety protocols. For example, we knew still that it's important that students get some hands-on experience in the sim lab, whether it's graduate students or undergraduate experiences. And what we realized was they can do it. The team came up with a plan, smaller number of students, but shorter duration. So they were able to get that immersive clinical experience in that simulated setting, debrief and see what they did right and what they did wrong, and be able to do that. We know we have to incorporate more telehealth training. As you said, going forward, it's not going to go away. So we're expanding this training to all of our nurse practitioner graduate programs to ensure that they have competence and confidence in telehealth technology and care delivery. How do I communicate with you via telehealth versus how I communicate you in the office might be different. So they're really working on how do we embed this into our programs. And we're learning with telehealth simulations as well as increasing telehealth with our community partners. We've also piloted BSN student learning in telehealth with interprofessional simulated education with our NP students. So we're trying to we want our students to work interprofessionally with other disciplines, so we also want them to work intraprofessionally within the discipline. So having our students work with our advanced practice students is another way we can do that. So we plan to integrate this further into our pre-licensure programs in the future. And the bottom line is we're committed to our excellence in education, in our research, and in our service. And we will continue to innovate and adapt as we take fluidity and flexibility to further our mission of really educating the nurses for the 21st century.
Yeah, well, I can't imagine what your admission requests are going to be as people are learning about this. But I got, I think, a really important question, because all of us with the changes from COVID, none of this was planned for when you made a budget. So I guess my question is, how did you pay for this? And is there any money left, or have we used up? I mean, we're only in the end of September. We're not even in December. Did we use up all of our money? What are we going to do?
Well, I mean, you're right, Andrea. None of this was planned for. None of our extra expenses were budgeted for. And like other colleges and universities, we had no idea we'd be dealing with the pandemic when we budgeted for the last year's academic year as well as this academic year. So we've had to provide more of our funds for technology and software, such as online test proctoring and simulation software that we really hadn't planned to do. We've had to add additional hardware to make sure when we deliver our courses online, like you and I are talking today, that we have good quality cameras, microphones, things like that, that we really didn't plan on buying. So we've really leveraged the funds we've had to ensure that we can deliver the courses. We knew we had to do it. Some funds come from our university and our fees, but in additional, we've had to use our internal funds to have additional support staff for supervision of our students, additional adjuncts perhaps to help in our labs with us. So we continue to rely heavily on our donors and alumni to support our efforts, especially during this challenging time. And we thank them for their support. Our alumni also gave generously of their time when we needed assistance in the summer when everybody was coming back. And I will say they have been great. They actually also came in last week to help with flu shots. So giving that time in addition to the financial resources has been really critical. So part of this is our goal to add 20 new Nightingale Society members by the end of 2020, the year of the nurse and midwife. And Christina has been leading that effort and being very successful, but we know every dollar counts and we are really being frugal with that. And we also know for this current fiscal year, we're going to have a budget cut. And we are right now working on a 3% cut, but until we know more, it could be, we could have more. So we're really being frugal as we move forward. So that support from all of you is very, very important. And we thank you as you also have contributed generously to our college.
Well, Christina's going to have a really good story to tell as she gets on her UCF night horse and rides around asking for money. We have another question from the Alumni Chapter Board, and it's really about current students. You may have already answered this, but I'm going to put it out there, and if not, let's answer it another way. How do you think this virtual learning has actually impacted the new normal for our students? Because we didn't even know what COVID-19 was. And now they're learning and practicing around it. If you answered it, we'll move on. But if you think there's more to say, I want to answer the chapter's question.
Yeah, thank you, Andrea. Yeah, they have learned. I mean, as I mentioned, we've had to do all the new safety protocols. So I think everybody in particular in the world now is aware of what are public health protocols we need to reduce infection, whether it's this pandemic or another one in the future. So that's really a good thing. We've learned how to do things in a condensed format. But one of the things the university is doing, and we're trying in our classrooms, it's called the Blend Flex model of learning. It's a way to encourage students to come to campus for classes, but it keeps capacities low. We have what we call our COVID-ready classrooms that are seat capacity reduced to ensure everybody's got the time and the space between them to have that environment. So we're bringing smaller cohorts in so they can come to class once or twice a week, depending on when they're scheduled. And when not physically in the classroom, they can receive online instruction, either live or recorded. So that's just, again, one way we're getting better at. And we will continue to get better as we increase the engagement that students are doing in those settings. And as you did note, the biggest impact on our students, though, is financial. So we know that our students have lost jobs. Many of them have worked in the hospitality industry and don't have those jobs. Others have had their hours cut or have been able to get a job as a nurse tech, which some of them wanted to do. And several of them have family members and spouses who support them, and they may not have had that. So we've had an increase in student need, and we do have a student emergency fund that we've had in place for several years, thanks to the Gertrude Skelly Charitable Trust. And we have really been using those funds up. And those funds have also been expanded thanks to a generous gift from UCF alumna, Carrie Callahan. And she was inspired to help after she read about our nursing alumni who were working on the front lines. So these funds are really essential that help these students that are during these challenging times. They don't get enough to cover their tuition, although the University of Central Florida is accessible and has reasonable tuition. When you think about all the expenses one has, they don't have it. So we want the students to continue and not drop out. So these emergency funds have been really absolutely essential to ensure students progress and graduate on time. We've already been able to help 6 students, and I understand we have a 7th request underway, who were in a very difficult financial crisis as a result of COVID. They weren't able to pay their tuition. One of them just said, I don't even know how I'm going to graduate this summer. And we said, absolutely, you will graduate. And we were able to provide the funds to ensure that occurred. Those who were still continuing in the summer have all continued to the fall. So we are really thankful for those who have provided these funds, and we're glad we have these emergency funds. Not all schools have those. And that's been really a very critical part we've been able to do for about 5 years now.
Wow. Well, I don't know Mrs. Callahan, but I just want to say thank you so much. And as we said earlier, the nation and the world, I think, has a much greater respect for what nurses do. And as we said earlier, I'm a nurse by education, but a year ago now, I was in a horrific accident and ended up not even in Florida, in another state, being in the hospital, in the trauma center and the ICU for 4 weeks. And I have a lot of energy. So I was constantly, into survival and what was happening. But it really moved me what nurses do, not only what they know, but what they do. So I guess I would ask you, do you have any stories of UCF night nurse alumni from the front lines of COVID? Because that might be interesting. And, also how other alumni, how are they dealing with the pandemic? Because we weren't trained for this.
No, no, we weren't. But our alumni are resilient. And our night nurses are those critical thinkers that the institutions want in that acute primary setting, both BSN and advanced practice as well. We have leaders that are nurse execs from our alumni board and our alumni, and they are leading the charge at hospitals in Orlando and North Carolina and others. So we're really pleased, that they're able to provide such strong leadership.
Did anybody go to New York when the governor was asking for nursing help?
We know, yeah, some of our students in our advanced practice programs went to hot zones like New York, New Orleans, or to serve with national agencies or the military. One of our graduates is in the military, and he was on the USS Comfort up in New York when they got deployed up there. We know that some of our alumni, for example, Trish Solano at Advent Health, was among 3 nursing executives to be interviewed by Becker's Hospital Review about lessons learned in nursing during COVID. So she was able to share that as a senior executive with the organization. And alumna Julie Vincent, who was a graduate of our Nurse Executive DMP program, is another executive at Advent Health, and she and her colleagues published an article on their COVID-19 response, innovations, and transformations in the New England Journal of Medicine Catalyst. Our other alumni who are more at the bedside have really contributed in different ways. And 2 of these are mine, so I'm really, really proud of that. But 2-time alumna Lauren Yan Murata did her DNP project about 2 years ago on strategies of turning patients onto their abdomen, or what we call proning. And how do you do it with a bed, or how do you do it with people to help turn those patients? And it's a process that helps to improve oxygenation that has really taken off with COVID, when we realize that people are having trouble getting oxygen, they need to be turned on their abdomen. So she has been contacted multiple times for her protocols, and we actually have an article coming out in the American Journal of Critical Care talking about what are the protocols and what are the safety things that really is just as easy and much cheaper and actually fewer complications to turn them with a team of 6 people, let's say, rather than buying or leasing an expensive bed. So she's become a leader in that area, and she'll be also presenting at the National Society of Critical Care Medicine Conference in the spring. And at the same time, collaboratively, when she was doing her DNP project, BSN alumnus Sarah Rose Thornton did her honors undergraduate thesis on the literature about prone positioning, which at the time really was only used in those very senior critically ill patients who had no other option. Now she writes to me regularly and says, Dr. Soul, we're using this at our facility. We're learning firsthand how to apply this in our ICU. And we're also piloting it in these patients who don't need a ventilator to prevent them from needing the ventilator. So I can tell you, I'm really proud of that. And our spring BSN alumnus, David Frederick, who was one of our outstanding Pegasus Award winners for that spring graduating class, did his spring honors undergraduate thesis on hospital footwear as a vector for organism transmission. Post-COVID, it has been downloaded in more than 12 countries, and he's really proud of that work as well as his faculty mentor. These are just a couple of examples because we know that our graduates are everywhere, and I am so proud of all of our night nurses, and we're now 12,000 strong, for their commitment to nursing science and compassionate care, and everybody needs that night nurse.
Wow. Well, we are certainly proud of our night nurses and their ability to change on a dime. But that isn't the only crisis that's going on in our country right now. There's been a long-standing and perceived systemic racism within healthcare and our society as a whole. We're seeing it on the news every single night. So what are the college, the faculty, what are we doing to address this, which was another question that the Alumni Chapter Board also has sent in. Because Dean, it's pretty important.
Absolutely. You know, as you said, in the midst of the pandemic and all the things we were doing, we knew we needed to address diversity, inclusion, and equity within our programs. And we are very sensitive to this issue, and we must, and we are focusing this as a priority. So the first thing we did was we had conversations with our faculty and our students. And the second thing we did was to create a diversion, inclusion, equity, and advocacy task force. And this is made up right now of volunteers, faculty, and staff. And I personally sit on this. I believe it's really important. And it has been just eye-opening and touching to hear stories directly from others. And it's also been very eye-opening to personally reflect and look about what we need to do and how I need to change and how we as a college can change. So I really want it to be part of my legacy that we can create change, and it's going to be addressed. We are addressing it, and we will continue to address it. We want to make sure that college is a safe and welcoming environment for students, faculty, and staff of all races. We want to make sure we're working in the community the same way, that we really address everyone so that our future nurses can address healthcare disparities and serve all equally. We've been active in the community for years, and that's a very important part of that, of how do we work collaboratively with all of that without bias. So we're starting with faculty staff training, and we're going to add training for the students. We know we need to incorporate further training into our simulation, into how we teach things, how we write our textbooks, how we write our articles, and how we ensure that our students are working in that diversity, inclusion, and equity for all. I'm committed, and I know our President Cartwright, is also committed to make it happen. And we are going to, and it's starting with baby steps, but it's going to continue to take off. And it's really, really important for nursing and healthcare as a whole.
Dean Soul, I really look forward to hearing about the progress of this task force in next year's State of the College address, because it is time, and leaders have to lead, and you certainly have been leading in so many areas. It's just one more thing for you to take on. But as we look ahead in this new normal, can you share with all of us the priorities for the upcoming year, as well as what's your greatest concern? I would tell you that one of my greatest concerns for you is you'll do the teaching, but we've got to do the fundraising, because we have to continue. But that's up to your, we got some good people doing that. But your concerns are going to be a little bit different.
Well, Andrea, I appreciate that, because as you said, that's important. But our top priorities, one of our accomplishments over the year that I failed to mention has really been our research as well. But so that is another top priority. You know, research helps to generate new knowledge, and it helps to generate knowledge that advances nursing practice and contributes to healthcare. So one of our goals over the next year is to further increase our funded research. You know, we really have been on a good trajectory despite the pandemic, with some of the research projects shut down or on hiatus, but we were able to actually generate $1.4 million in new funding just since July. That's an amazing accomplishment for us. And I know several new grants are going out this week. One went out today. So we have a mix of a variety of federal grants and others, but our priority is to achieve at least $2 million in new external funding per year. And ideally, we get it up more than that, but we're on a great trajectory, and our faculty are really moving well with some amazing projects that look at things such as fall prevention, preventing preterm births in Black women. And those are just two small examples, but those are just a couple that we're working on. We also want to continue our involvement with interprofessional research clusters. So we are an active participant in a research cluster called Disability, Aging, and Technology that bridges the College of Health Professions, psychology, and engineering together with nursing. And we have nursing aging experts, not aging nursing experts, nursing aging experts who are doing that. And we're active in that cluster. We're active in the bioinformatics cluster. That's a new one, but we've been working with the bioinformatics individuals to look at some of the genomics data related to how do we prevent those preterm births? How do we prevent infection in critically ill patients? So that's a new partnerships we've established. And we also have a beginning relationship with a cluster called Violence Against Women that's together with the College of Health Professions, Psychology, and Social Work, and the College of Sciences. So that's something we want to continue to do. We want to continue to build that research. We want to continue to strengthen all programs, including our signature programs in nursing leadership and simulation, where we are achieving national recognition. We want to continue to be that leader that has 100% pass rates, that has nurse execs in the community, that has individuals that want to come to the University of Central Florida for their education. We need to develop opportunities to generate new revenue. We know with the budgets being what it is, we want to look at how do we develop new revenue streams. So we're looking at how do we provide perhaps consultation service and continuing education. And our simulation expertise will be the first leader in this area. We also want to be a key unit of the emerging UCF Academic Health Sciences Center. That Academic Health Science Center brings together the College of Nursing, the College of Medicine, the College of Health Professions and Sciences, and UCF Student Health and UCF Health, all together under one umbrella. And we're working on strategic planning to emphasize interprofessional learning, interprofessional research, clinical practice, and biomedical research. And how do we move that forward? And that's, UCF Nursing needs to be and is a key component of that Academic Health Sciences Center. We want to refocus, we had planned to begin some space at Lake Nona campus, and that had to take a back door to a variety of reasons. And we want to refocus that on getting built space on that UCF Lake Nona campus to facilitate that collaboration with the Academic Health Sciences Center and the UCF Lake Nona Hospital that will open next year. We know that, but what's interesting as we go forward, we know that COVID has impacted how we build future space. So this provides an opportunity for us to think about what space we need in the post-pandemic environment to enhance education and learning, but it may be different than we had originally planned for. And we want to work with our current and future partners at the UCF Lake Nona Hospital to provide unique clinical experiences in a new setting shortly after opening. And as we work towards these goals, our biggest challenge is going to be funding, as you mentioned. We're implementing multiple programs amidst likely budget cuts and existing budget cuts to the state university system budget. So part of our plan this current year is to reduce costs, increase efficiencies, and identify new opportunities for revenue generation. And we will continue to engage with and rely on private donors such as you, the Skelly Foundation, Carrie Callahan, and all of our community support to help us achieve these goals and support our students through scholarships.
Well, thank you, Dean Soul. We've got some questions, and I'm going to combine two of the questions which you just touched on. One is from Craig, and one is from Daryl, who is a parent. And their question is, with all this virtual training, is there going to be a shift away for the need for more bricks and mortar? And how does that update with the Lake Nona plan? So I combined both those questions into one.
No, that is a great question, because that's what we're really beginning to rethink everything. We do believe we need bricks and mortar. We need space to be able to provide classes. We still need to have that face-to-face interaction. We absolutely have to have strong simulation labs. We need to incorporate our technology with augmented reality and virtual reality, which we're already doing with our faculty in that area. So we want to continue that, that as well. But we know we're going to have to re-envision it. We know now what a classroom that we had planned to have 150 people in, we'll see 60 or 70 people. So we want to think about how do we have space that's flexible? How do we have space that you can have small group learning, big group learning? We may need space for studios. As we get more into how do we deliver things, we all know what sound looks like and cameras, and so we're going to have to think about that as other options. So we have experts on our Dean's Advisory Board and others that I'm going to look forward to is what does this new space look like? We know that we will have more people telecommuting, so we will likely need fewer offices, smaller offices, as people learn to work from different areas. So we know that's still going to be a need, but we're going to have to revisit this of what does it look like, because I envision nobody actually truly has dreamed what this is going to look like. So we want to re-envision that for the future.
That's really exciting, and the time is flying by, but we have a really good question from my longtime friend Ken Peach, which I shouldn't say his last name, but he's a longtime friend. So nurses have always had to make choices about where to practice, but with the amount of increased care moving to the home and all of the AI that is getting developed and not going to the doctor's office, how do you see this impacting nursing education?
Well, I'm going to thank Ken for that question, because it is good. We realize we have got to be out in the community more. We've got to embrace the telehealth more. We have to think about how do we have students in these home settings. We know that our acute care organizations want to reduce that readmission rates, and we know that occurs in the home, and we know that. So having that, and we have piloted some experiences with students doing that home health, during that those transitions of care, because that is important. And we know that our advanced practice students, in particular, both the primary care and the acute care, are going to be leaders in that and helping to manage these patients. So leveraging that expertise in telehealth of how do we manage that patient with heart failure in the home? How do we manage that diabetic patient in the home? They've gotten used to now some of these televisits, and many of them are going to be expecting that. So I believe, Ken, that is going to be critical and more important than ever to include more of those community experiences, not just acute care in the hospital, but acute care, as you know, is in the home as well. So having that provides additional opportunities of how do we leverage that and work with our students to ensure that both at the undergraduate and the graduate level, and have the educated nurse leaders who have the vision to also think about how do they do it within their agencies.
Okay, we only have a few minutes left. One last question. How is UCF filling the gap with policy and research since the Florida Center of Nursing closed? Is that a fair question?
That's a really good question.
Oh, good.
The Florida Center for Nursing did close in July because the budget for that center was vetoed. And they did, met the needs of policy and data collection over the years. And so we are working together collectively to try to see if we can get funding restored for the center, first of all. And we know we have to, there are other agencies within the state that are taking on some of it for data collection purposes. But it is creating a gap, and that center closing really is going to provide it's going to prevent us from having some of that data we need to be able to plan for the future. So we're going to have to look at how do we all step up to look about what are the needs for nurses in the state, and how do we best determine what we have for capacity goes and what are the needs go. So that is a crucial thing, and we really need to work with our legislators. It's written in statute that we have a center, but it's been budgeted very little for it during its entire history. And much of what's been done was operated via philanthropy and projects. So we want to continue to work with that. And we have a group in the state called the Quinn Council, which is all of the state organizations for nursing. And we just had a meeting the other day. We're looking at how do we move forward with the lobbyists and with getting information to the governor of what a gap that has left so that could continue.
Okay, we have about 4 minutes. So what do you think are the top 3 takeaways for people that might have come on the call later or had to jump on and off? And we have to do it quickly, but I want to make sure we do it. Oh, and I also want to thank all of the viewers that tuned in to listen. I think there's a wealth of information. It's just awesome. And keep your donations coming, right? Because that's what I keep worrying about. Top 3 takeaways.
Well, yeah, thank you, Andrea. And I want to thank you for hosting this with me today. First of all, our takeaway is UCF has a great nursing program. We have an amazing program that prepares undergraduate, graduate, doctoral level nurses. And right now, everybody needs a night nurse. Everybody needs that night nurse who's a leader, an innovator, and a critical thinker at all levels. Second takeaway, we know that technology that includes telehealth, simulation, virtual learning, artificial intelligence, all of those things are going to be critical as we move forward, together with inter and intra-professional education. Linking all those together is going to take on greater importance of how we educate the nurse of the future. So we know we're going to implement best practices and continue our innovative teaching and research in technology and intra-professional education. And lastly, again, the takeaway, as you've mentioned, is to support our future night nurses and our current night nurses, our research and our technology. We continue to rely on all of you out there and your friends on your financial support for us. And we thank you for all that you've done, and we need your support now absolutely more than ever. So, history of excellence, everybody needs a night nurse, technology and interprofessional education, and funding and support for all that we do.
I want to thank you very much, Dean Soul, especially today, because somebody told me today is your birthday, and you did this on your birthday, which is very exciting. So we all want to wish you a happy birthday. I think there might be a little special delivery to help celebrate your.
Oh, geez. Oh my gosh.
So, that's what happens when you get to, when you're the
oh
dean,
my.
you're special.
I'm red. I don't know whether the red is showing up on the camera, but as long as you promise not to sing, although, that would be all right, but I'm really not expecting that.
You roll with it. That's awesome. Well, we want to thank everybody for joining us during the 2020 State of the College of Nursing Address. And thank you, donors and night nurses. Thank you, Dean and faculty. Thank you, President Cartwright. This is a very special college, and we should all be very, very proud. And as I said, because I worry about how we're going to pay for this and stay where we are, we even have a little slide up there that tells you how you can help. Volunteer or engage, and certainly try to attend our event on May the 15th, 2021.
Yeah, so let's just get rid of this pandemic so we can have a big giant 40th plus party for those graduates of the class of that started in 79 that graduated in 81. So I thank you all. Thank you, Andrea, for hosting us.
My pleasure. It's been fantastic.
And have a piece of cake with me, a virtual piece. There we go. A virtual piece of cake.
Nice. Nice.
Bye-bye.
Goodbye, everybody. Thank you.
Bye.